Hi, guys. How are you? Dr. Pam Turner, Academic Coaching for World Changers. And remember, my only goal is to help you get this stupid sheet of paper. If you don't know a lot about me, if you go back through some of my YouTube videos, you'll find a lot about me. I've been very transparent in my life. I am a preacher's kid, and I thought I'd be happily married forever. It didn't work out that way. My mother died when I was young. I was in a very bad relationship and my husband died. So I tell people that I was born about 9 years ago. He died a couple of years before my 50th birthday. I'll be 60 in 2025. Even when I was married, I raised 3 children by myself, and I got a whole history like everybody else does. I can just tell you that I am very blessed to walk out what God has planned me to do. I hope that every time you interact with me or any of my staff, that it shows that we love what we do. And we are trying to walk out what we think our higher power has caused for us, has planned for us. And we also think that's a plan for you. So let's get to today's question. So, by the way, we're always going to say, remember, we really thank you for being with us. Invest in yourself. You are worth it. I cannot tell you enough. We suggest that you study 15 hours a week for 90 days. What? Yes. Hour in the morning, hour at lunch, hour at night. Same video over and over and over again. We do not believe that taking test questions is how you pass the test. We've learned content and then applying them. So we're really going to remind you that whatever test you're taking, that there are two ways that we answer tests. It is either application, right? And remember, we're going to assess. We get paid to be nosy. We're in a field where they pay us to ask questions. Who else gets paid to ask? Well, have you thought about sleeping with men? Does your husband know that you prefer women? How much money do you have in the bank? Were you molested when you were 3? That's our job. That's our job. And I'm not going to say that we take pleasure in it, but I'm going to tell you that you were nosy before you came into this field. That's why I say we get paid to ask the questions. They seem to flow naturally for us. And if you're new in the field, and they're not, they will. Just give it some time. Most people love to talk about themselves. I will say this to you, whether you're doing an interview with a client or whether you're at a bar, people love to talk about themselves. Just ask them some questions. Of course, the other questions are going to be those recall questions. Now, way back in the day, they really were very simple. Who is Freud? What are Freud's stages? Bloom's taxonomy, if you've ever had any education class, talks about higher level thinking. If you're in administration or any kind of program where you have to write SMART goals, you know that we don't write goals at the remember level. We write them at the apply, analyze, and evaluate level. You all have a master's degree. No one gave it to you. You use those very same clinical skills or thinking skills, cognitive skills, schematic thinking when you were in school. The only problem with this test is I only have 4 answers and I can't BS my way through it. I really have to pick the best of the 4 based on what the question is asking me. But at the end of the day, I'm going to remind you, it's a reading test. It's a reading test. I had a session today with someone who's taken my 5-letter exam, the NCE, which is one of my favorite exams. It's a clinical scenario. And what she was doing is what many people have been taught to do. I would ask her, what is the question asking you? And she would read the last line. Why do you think they put all of those paragraphs and words in there? Just because? They're not distractors, hints, clues. All of those things are giving you the clue to answer the question. That's what makes it a standardized test. Everybody gets all the hints and the clues in the question. And I've said before, I will take a paragraph any day over a one-line question. Oh, I want to scream on those one-line questions. If you don't know what it is, many times you're lost. We always want you to increase your vocabulary, whether it is a clinical term or not. Many people just miss the question because they don't understand American idioms. American idioms. There was a question today, and I think the term was anhedonia. Anhedonia just means lack of pleasure. It's a clinical term, but in the question, it wasn't used as a clinical term. And the client missed the question just because they didn't know what it meant. So I cannot tell you how important it is to increase your vocabulary. Keep your closed caption on when you're watching TV. When you're taking practice questions, take the word, highlight it, put in plus counseling, plus psychology, plus whatever, and keep a running list of words. But don't just use them for the test. Girl, use them in conversation. Egosyntonic, ego dystonic, right? Yes, I'm OCPD, oppositional. I'm OCPD. I have an obsessive compulsive personality disorder, but I'm fine with it. It's in sync with my ego, right? Ego dystonic means I come for therapy because I don't like the way it feels. We can talk about Freud. Freud talks about insight. The goal of psychodynamic theory is to bring the unconscious to the conscious. All those things are hidden. Whenever I see the word intra, that prefix intra, that usually means inside of me. Remember, inter means at least two people. I'm always going to say intercourse takes two people. I don't care what uglies you bump. I don't care what goes where. I could care less. I don't care. That is still intercourse because you're not by yourself. There's another word if you have it by yourself. INTER, interdisciplinary meetings are the same as multidisciplinary meetings, right? INTER means more than one. We know if we talk about DBT, Marsha Linehan, she says we're going to work on having INTER, interpersonal relationships, learning to work with others. An INTRA, intradisciplinary meeting, means we're all the same profession. We're all social workers. We're all counselors. We're all whatever. Just some of those prefixes that will really help you get through the test. Again, our goal is never, ever, ever to make you a better clinician. I want you to get this stupid sheet of paper, but I also want you to sound damn smart. I want you to walk down the hall using all of that psychobabble that you learned in school. Of course, we don't use that psychobabble or that psycho jargon with our clients, but in a conversation with colleagues, isn't it nice to know hypomania versus mania? It's nice to know that persistent depressive disorder is 2 years as opposed to 2 years in adults as opposed to 1 year in children. I remember many years ago when dinosaurs roamed the land before I had my LCSW, and I said to my supervisor, I want to learn the lingo. And that's what she said to me. Just listen, read notes. When the psychiatrist drops a note, read it. That's how I learned diagnosis. The psychiatrist would write the diagnosis. I'd go back to see if he was right. I know, psychiatrists. Okay, maybe not none of yours, but people I've worked with thought they were God, and everybody had schizophrenia. The DSM says I cannot diagnose you with schizophrenia until you've at least had those symptoms for 6 months. Got it. Pre-psychotic disorders, 3 days to 30 days. Schizophrenic form is going to be 1 month to 6 months. And then when we get to full-blown schizophrenia, you have to have at least 6 months worth of the symptoms. Again, I'm not going to go back to the psychiatrist and tell him he's wrong. I'm just using it as a learning tool. I always want to keep learning. One of the things I'm going to tell you, as much as you learn content, and please learn content, You have to learn what it looks like in a question. And they're never going to be simple, whether it's one line, whether it's a paragraph, they're never going to be simple. This is an application test, not a recall. Okay, so here we go. A hospital social worker has been called to evaluate a patient who's been dealing with a diagnosis of terminal cancer. Okay. Recently, he came to his physician and offered him a considerable sum of money to pursue an unorthodox, unproven treatment. Unorthodox, unproven. Okay, that is definitely not evidence-based. The physician tried to explain the problem of such treatments, but the patient remained insistent and even accused the physician of being uncaring. He said, "You don't care about me." So try to, my dog is barking. I apologize. The physician remained insistent and even accused the physician of being unwilling to seek a treatment in deference to continuing to bill his insurance for fruitless procedures and treatments. Deeply disturbed, the physician referred the patient to the social worker. After speaking with the client and confirming the above, the social worker recognized the symptoms of as a characteristic of what? Okay, guys, I'm going to have to give a doggy treatment. So just give me a doggy treat me 1 second. So let's continue to read that question. Yeah, so complicated there. So I'm a hospital social worker. And by the way, most of my people who are hospital social workers don't do well with hospital social work questions because you bring yourself in. And unless you see your first name, last name, and I'll say your social security number, we don't really care what happens in your hospital. But in this one, I've got a man, and the man has got terminal cancer, right? He's dying. And he went to the physician and he offered him a lot of money to pursue an unorthodox, unproven treatment. Obviously not evidence-based. And if I were taking the NCE, I would know that this is not okay, right? So I can't do this because that's malfeasance. And the NCE Code of Ethics says I'll do no harm, non-malfeasance. I don't know if it's working or not. So the physician tried to explain the problem with such treatments. Hey, this may not work, but the client was insistent. I've got $1 million. I'll do whatever it takes. The physician, of course, now is upset because obviously physicians want to save you. And if they could, they would, right? He begins to say, you just keep bailing my insurance, getting money off my insurance, and you don't really care about me. Now, the physician is really upset. And he calls the social worker and he says, hey, can you go help this client? Now, I would like to think that I have a really good idea and I could probably guess the answer just based on what I know. So if you are one of those social workers and you think you know the answer, you can stop right now, come back in a few minutes and tell us know if you got it right. But for those of us that want to make sure we got it right, we're going to go through the process. So what I'm going to always do is, like I said, understand what the question is asking me. I know it's a reading test. I understand it's a reading test. So my 4 options: is he having a psychotic break? Is it chemotherapy toxicity, grief bargaining, or acute denial? Ooh, Dr. Pam, I don't know. So while we're taking practice questions, because these are not real questions, we're going to make sure that we understand what KSA, what knowledge, skill, or ability is this test answering? What are they trying to see if I know? So let's look at all 4 of them. A psychotic break. Now, psychotic break is often related to a schizophrenia, right? It doesn't have to be, though. A psychotic break or a psychosis or a psychotic episode is a loss of reality. It can be a lot of things. It doesn't necessarily have to be a sign of schizophrenia. If you're using an MSE, a mental status exam, the person in front of you may be hallucinating. They may be having delusions. They may not be in touch with reality, but that definitely does not mean that they have schizophrenia. It could mean that there is some schizophrenia, some bipolar, severe depression. It could be substance abuse. It could also be just physical. Okay. So a lot of those things, genetics, such as physical or emotional trauma, brain injuries, medical conditions, and stress can also lead to psychosis. So having a psychotic event, losing touch with reality, doesn't necessarily mean it's schizophrenic. There could be other reasons that do that. And I said to you earlier that if we're going to diagnose schizophrenia, we have to make sure that we follow the guidelines. 3 days to 30 days is a brief psychotic disorder, and 1 month to 6 months is schizophrenia form, a form of schizophrenia. And then my last one is schizophrenia, and that's at 6 months. And remember, you have to have both a schizophrenic, and I'll remember all 5 of my senses can hallucinate. Smell things, I can see things, I can taste things, I can hear things, I can feel things, and then I can have delusions. None of you probably know, because in my very old videos, and it's still true, I am sure Barack Obama is in love with me. I know. You don't get to question me in my delusion. Right? So that delusion is called erotomania, when someone famous is in love with you. But remember, if someone's having a delusion, you support their delusion. You don't have to agree with me, but you can't argue with me. So schizophrenia and psychosis are not always the same thing. Psychosis can be a part of schizophrenia, but they're not always the same thing. You will see that psychosis has some hallucinations, maybe some delusions, some agitated thoughts, some disorganized thoughts or behavior. But wait, Dr. Pam, that sounds like forms of schizophrenia. The difference is there can be other reasons that cause psychotic breaks or psychotic episodes. In schizophrenia, it's because I've got a diagnosis, and I have had at least 2 of, so the diagnosis must include at least 2 of the following symptoms for 6 months, including one of the first 3. A friend of mine, I found out, was allergic to phenergan, because they woke up in the middle of the night and they were sleepwalking and had no idea where they were. So that psychotic event, that loss of touch with reality, was an allergic reaction to phenergan. Nothing else. Nothing else. Okay? So now that you understand at least some of the terms, let's keep going. Oh, chemotherapy toxicity. I don't know about you. I have a doctorate degree. I'm a doctor, but I'm not a medical doctor. Nowhere in any of my programs did I learn about chemotherapy. And it could be a reaction to chemotherapy. And that definitely could be a test question. If the question said that the client has gone through chemotherapy and now they're having some hallucinations or psychotic, that might be an answer. But I don't recall reading anything in that question, that person having any kind of cancer or any kind of treatment for chemotherapy. So A, it's out of my scope. But by the way, if you want to know, chemotherapy toxicity is when you get, so chemotherapy kills the cells, right? If you've ever had anybody with cancer, I've had a mother and a son, and what we know is that chemotherapy, cancer cells grow at a much faster rate than regular cells. So whenever someone is diagnosed with cancer, in my experiences, we get them in treatment right away, because those cancer cells grow and grow and grow. And chemotherapy kills everything, the healthy cells as well as the unhealthy cells. So when I'm putting that much, and I want to say poison and not because it's a bad thing, but I'm killing all the unhealthy things, then of course I can have that toxicity in my system. I can tell you for my own child, after the chemotherapy was over, he could not go back to college or living on college campus because all of his white blood cells were killed as well. White blood cells fight off all of those bad things that happen. So I am personally familiar with chemotherapy toxicity, but I'm not going to answer that question because I did not go to med school and my program did not go to talk to me about med school. I get to stay in my lane, and unless it says MD after my name as opposed to PhD, I am not going to pick that answer. Okay, so the last one talked about grief. Are they talking about DADA? Denial, anger, bargaining, and depression. Kubler-Ross has been around forever and forever and forever. Kubler-Ross, in the beginning, talked to us about the stages of death and dying. And what she really said is this is what happens when we lose somebody or we are dying. What we know now, it is not just about me dying or someone I know dying. It's about loss of a spouse, and that could be divorce. It could be loss of hope. I have a baby that has a physical difficulty or a physical difference that I wasn't prepared for. I had a car accident and I can no longer do what I wanted to do. I lost my job that I thought was my dream job. So what we know is DABDA, denial, anger, bargaining, depression, and acceptance, belongs to any time that we go through a loss. I had a friend whose son went to prison, and I watched her go through these stages. So according to Kubler-Ross, remember that we don't necessarily go through the stages in order. Some of us spent more time in any of the stages, right? Some of us are more often in denial. Some of us spend a whole lot of time in anger, more depression, bargaining, DABDA, denial, anger, bargaining, depression, and acceptance. Those are Kubler-Ross's stages of death and dying. So what I did for you is I went through all 4 of the possible choices. So again, this is not how we take a test. This is how we study. If you're going to use test questions, don't just try to get them right. Learn the content. If you learn the content, you can get every single test question right. No matter how it's written, you've learned the content of how we answer the questions. Okay? Acute denial. I don't think that's a term. It's not a clinical term, at least. You might see that other places, but that's not a clinical term. Denial, of course, is part of Kubler-Ross, and it's also one of my defense mechanisms. With my defense mechanisms, denial almost always belongs to drug and alcohol use, pedophiles also, any kind of addiction. It wasn't me, wasn't me, wasn't me. When it comes to answering test questions, remember, denial is when we're going to confront, because what's happening in my body is not matching what's coming out of my mouth. Carl Rogers called that genuineness when it matched, right? Congruence is when it matched. And if it doesn't match, then I'm not genuine. So acute denial is not necessarily a term. Acute in general for our health terms means it came on short and sweet. So that is not a term that I'm going to keep. So now I've got down to my 4. I'm going to go back and read my question again because I've learned so much, right? The hospital social worker has been called to evaluate a client who's been diagnosed with terminal cancer. They're dying. They're not dead yet, but it's terminal cancer. That means there's no cure. Recently, he came to the physician and said, hey, I got $500,000. If it were me, a considerable sum, it might be like 1,000. Okay. But it's not about me. He gave him a lot of money. He said, there's this unorthodox treatment, and I want you to try it. Unorthodox, again, means it's not something that we would normally try, and definitely not covered by insurance, and would not be something that, it could be something a person, a social worker, a counselor, someone could lose their license for. The physician said, oh, we can't do that. We can't do that treatment. The patient remained insistent. And he said, you just want the money from my insurance company. Yes, I'm paraphrasing. I'm adding some things. I don't want to change the verbiage, but I also don't want to just go back and read the question. I don't understand the question if I haven't taken the time just to read it. After speaking with the client and confirming the above, the social worker recognized this as what? Okay. So my 4 choices were a psychotic break, a chemical toxicity, grief bargaining, or acute denial. We're going to rule out 2, right? Okay, I think we decided that there's nothing in there that talks about chemotherapy where he's getting anything. It did say that he's a cancer patient. I get that. But the question, it's a reading test. It would have said he's on chemotherapy. The question didn't say that. Don't think, just read. Okay. I know that it's not a psychotic break. He didn't talk to me about how he sees and hears things. So I'm taking out both A and B. It left me with C and D. And now that I understand all of them, right? Oh, but Dr. Pam, grief and bargaining, those are separate. Oh, Kubler-Ross didn't have those together. Don't overthink it. It's the best of the 4. It's the best of the 4. Okay. Kubler-Ross's symptoms of grief bargaining, right? So Kubler-Ross, she was a social worker, by the way, and I know all of us use her theory. So the stages of anticipatory dying, that's when she first started, right? Were denial, anger, bargaining, depression, and acceptance. Now we know it's not necessarily about always death, but it is always about loss. Guys, I really hope that you enjoyed the question today. I hope that you really learned something today. We really know that you are the very, very best social workers. We are not pretending to make you any better. And for those of you that are still equating passing the test with being a social worker, I cannot tell you enough that that is just not true. There are tons of people around you that have a license that are not good social workers. Good social workers come from supervision, time. That's it. That's it. That's it. That's it. Not the sheet of paper. But you need the sheet of paper because I need you to change the world. There are people out there that are waiting for you to change the world. Thanks for tuning in to another podcast, another session with Dr. Pam. We do have podcast channels. We have individual and group sessions. We have lots of ways to help you pass the test. We definitely want to be here. We'd love to celebrate your success. So reach out to us, drpam2020@gmail.com, and also follow us on all of our social links below. Bye, guys. Thanks for being a world changer.